Hi there, folks. I am happy to share some scoop with you about the global health electives that we're really hoping to be able to offer and anticipate being able to offer this spring. And this will be an overview presentation to give you a feel for the dates, a little bit about the application requirements, and specifics about individual electives, and we'll also be pointing you to some resources to get more scoop on individual experiences. Before we go through the specific rotations, I want to give you an overview of what the elective opportunities are. In Africa, there are four options. One is in Malawi, one is in Mozambique, and there are two sets of electives in in South Africa. One is in Cape Town, and the others are in KwaZulu-Natal, and there are two clinic sites there. And depending upon the level of interest, we may be sending students to one or both of these rural sites. In Asia and the Middle East, there are four options, one in China, one in Thailand, one in India, and the tentative one in Beirut, Lebanon, that we'll talk about more in a few moments. And in Latin America, there are four options, one just across the border in Tijuana, southern Brazil, Quito, Ecuador, and in the Amazon region of northern Peru. The dates, some important dates for you to keep in mind. The application deadline will be September 8th, and applications will be submitted via Qualtrics. And we're hoping to let you folks know by mid to late October in anticipation of planning pre-departure orientation. And there are two required experiences. And if you're unable to participate in these experiences or can't make a commitment to these, then these are requirements. So just please know that if you are applying, you need to be able to participate in an almost all-day orientation program on Saturday, January 31st, and there'll be a mandatory feedback session on the day before graduation on May 28th. A little bit about the dates. Most of the electives you can see will be not in the immediate 3 weeks after match day, but the subsequent 3 weeks. And that will be from April 13th to May 1st. But the elective opportunities in Thailand and Peru will be the first 3 weeks after match day. So it means taking off to Thailand or Peru on the weekend right after match day. So we're going to get started first with the opportunities in Africa, and we'll start with Malawi. The Department of Medicine at UCLA has had a long-standing relationship with Partners in Hope. This is a faith-based NGO, and there will likely be some UCLA internal medicine residents there, and hopefully a faculty member for medicine as well. There's a very heavy focus on HIV/AIDS in this experience. It's more outpatient than inpatient, although there is somewhat of an inpatient experience. Mostly adult, although there will be some pediatric patients. And in addition to working at Partners at Hope, you will have an opportunity to visit some other clinics and the large public hospital in Lilongwe. Now, in Mozambique, I established the partnership in Mozambique about 15, 16 years ago. And when I started there, for the 10 million children in the country, there were only 10 Mozambican pediatricians. There were no pediatric surgeons. There were only two pediatric ventilators in the country. And that's because after independence, Mozambique had years of civil war, and it took quite some time until they started getting folks enrolled in medical school and the pipeline of trainees building again. This is a huge you would work at a huge public hospital. It's the major medical school and major referral hospital in the country. It's about a 1,500 bed hospital. The experience is centered around pediatrics. And one of the highlights of this rotation is working with Chris Buck. And Chris is an amazing master teacher and really role model for humanism at the bedside. Chris is a full-time UCLA faculty member who is based in Mozambique, and you'll have an opportunity to rotate on different wards. The campus is a huge campus. It reminds me of the VA with lots of buildings spread out on the grounds. Mozambique is a Portuguese-speaking country. It's one of the five Portuguese colonies in Africa. You don't need to speak Portuguese to participate in this, although comfort level in Spanish is certainly helpful, not required, but would be helpful. And Mozambique has this magnificent coastline. And for perspective, that coast of Mozambique is longer than the distance from Seattle to San Diego, and it's lined by beautiful beaches. And Cape Town, Maputo is the capital of Mozambique in the far south. Now, speaking of Cape Town, that's the first setting that we'll talk about for the South African electives. And this rotation is held at Somerset Hospital. It's a major teaching hospital for the University of Cape Town School of Medicine. It's not their Ronald Reagan equivalent. It's not their tertiary quaternary care hospital. It very, very much reminds me of Harbor. And interestingly, um, it's an older building, but they have a new wing, which is the emergency department, much like at Harbor. And there are two experiences that you could sign up for, an elective in inpatient pediatrics or an elective in the emergency department. And the experiences in all three South African sites are very, very hands-on. So a very different experience than Cape Town is traveling to this portion of the country, and that is the region called KwaZulu-Natal. This is where Nelson Mandela was raised, and there are two clinics. There are two hospitals, Emaus Hospital and Miscellany Hospital. They have affiliated clinics as well, and these are first level rural hospitals that are affiliated with the medical school in Durban. And we've had a really great relationship with it's called the Nelson Mandela School of Medicine in Durban. And all of the medical students there must do um, rotations in rural hospitals. They have about 15 or more in their network in KwaZulu-Natal. And the faculty leadership at the medical schools has identified these two sites for our students, and we have actually visited all of the sites we're talking about, but in the context of KwaZulu-Natal, we have visited both of these rural hospitals. The teaching is amazing, an incredible amount of hands-on experience. The physicians who staff these hospitals are all family physicians, and they do everything. They're amazing. They do surgery, they do their own anesthesia, they do C-sections, amputations, minor surgery, um, resuscitations. They're just really incredible folks. And lots of codes, lots of trauma. It's a very different experience than in Cape Town. And you've got to have a bit of a sense of adventure for this one. When you land if you were in Cape Town, you would take a taxi um, or you would take an Uber to wherever you're staying. When you land in South Africa, either in Johannesburg or much closer in Durban, you're going to rent a car with the other students, and together you're going to drive to your rural site, whether it's Emos Hospital to the west or Miscellany Hospital further north. And Miscellany Hospital is right near the Mozambique border and Eswatini. And it's driving on the left side of the road, maybe a stick shift, although you can probably rent an automatic. So it's a bit more of an adventure, and you're driving through rural areas of South Africa, and you arrive in both sites are incredibly welcoming, and it's a phenomenal hands-on experience. The Now we're going to zip to Asia, and we're going to talk about the experience in Hangzhou, China, and our partners there are based at Zhejiang University, and they have multiple hospitals, and students usually rotate at hospital number two, although there is a children's hospital if you have an interest in doing some pediatrics there. This is really a large, beautiful city. It's about 2.5 hours southwest of Shanghai. For this experience, proficiency in Mandarin really is needed for this experience. And 3-week experience is divided as follows. You would spend 1 week doing traditional Chinese medicine. You would do 1 week in a specialty of your choosing. And then the third week, local medical students will take you to a semi-rural primary care setting so that you get a feel for medicine in a very different setting than the big city. The hosts are very generous at Zhejiang. They provide free housing just a few blocks very close to the hospital. India, the experience is in Mumbai, and our host there is King Edward Memorial Hospital, and this is a massive teaching hospital with a top tier medical school, and this is an internal medicine experience. The physician who takes care of the UCLA students on this global health experience is amazing. She's a phenomenal teacher, and every student comes back raving about how much medicine they learned from this experience. This opportunity was set up by a DGSOM alumna named Dr. Rati Godrej. She's an American woman who was raised here in West LA. She went to UCLA undergrad, medical school at UCLA. She trained in internal medicine at Cedars. She married a man from Mumbai whose family business was there. So she moved to Mumbai, raised her family there, but they're really have their feet in both India and the States, and she's an incredibly generous host as well. All right, so Thailand, when we get to, I want to just highlight that Thailand is one of the rotations that has earlier dates. It's the first 3 weeks after match day. And depending upon the numbers of students that may be interested in Thailand, there are two different hospital options for you. One of them is Siarat, and Siarat is really one of the oldest and most esteemed hospitals in the country. That's where the king of Thailand was hospitalized for quite some time in this premier esteemed hospital. Most of the residents and attendings will speak English, so rounding will be in English for you. The patients will not likely speak English. And when you're there, 1 week at Sirat will be in traditional Thai medicine and Thai massage. And then you could elect to spend time in either pediatric infectious diseases or adult infectious diseases. And there's a wide variety of pathology there. Dengue, TB, opportunistic infections, HIV, AIDS, etc. The other hospital is Thammasat. It's called Thammasat Choluborn. It's tied into a different medical school, and this is a tertiary care government hospital. It's a little bit outside of the city, but they have excellent teaching. One proviso is that if you have an interest in pediatrics or OBGYN, there is no peds and there is no OBGYN at Thammasat Choluborn. But whatever rotation you do at Thammasat, and they have many surgical subspecialties and medicine services. You would also do 1 week of kind of a integrative medicine that includes traditional Thai medicine. All right. The experience in Beirut is quite tentative, and we'll have to see how things evolve within the region over the year ahead. This is an elective rotation at the American University of Beirut, which is a superb medical school. We've had a fair number of AUB medical students rotating with us here. There are so many services that you can do at at AUB. They have anesthesia, pathology, dermatology, radiology, emergency medicine, family medicine, different medicine subspecialties, OB, ENT, psych, surgery, and surgical subspecialties. Familiarity with Arabic would be very, very helpful for this experience, but it is not mandatory, and efforts will be made to team you up to pair UCLA students with bilingual AUB students. So now we're going to zip to Latin America and first Tijuana. And we've established a really nice relationship with Refugee Health Alliance. This is a nonprofit just across the US border in Tijuana. And this nonprofit serves many migrating individuals, folks who are migrating throughout Latin America who get stopped at the US Mexican border. And there's also a large Haitian population and even some immigrating folks from sub-Saharan Africa. This is a hands-on experience and also a wonderful way to learn about refugee health issues. Conversational Spanish is an absolute requirement for this elective, and you will work with both American and Mexican physicians in this setting. Right, jumping down to South America, in southern Brazil, there's an experience in Porto Alegre, and we have a really nice relationship there. There's actually a tripartite relationship with Mozambique, Porto Alegre, and UCLA with students going in all and residents going in all different directions. Porto Alegre is between Sao Paulo and Buenos Aires, very close to Uruguay, and you can do any subspecialty service there or specialty service. You will be teamed with English-speaking students. The faculty are terrific. They've had lots of experience with visiting students, and the feedback has been excellent. All right. Ecuador, Quito, Ecuador. We formed this relationship 3, 4 years ago, and the experience is at the University of San Francisco in Quito. This is a top-ranked private university in the country. They have an excellent medical school and really very strong global health programs of their own. In the city, in Quito, you can choose to go to one of two public hospitals. They have all services except peds and OB. Another option is to go to the children's hospital, and there's also a maternity hospital. You will be working with local students, and you need to speak Spanish for this experience. There is an option to work in a semi-rural primary care clinic, not so far rural, it's commutable by bus each day from Quito. And our students last year really, really enjoyed doing this. And again, unlike Brazil, where you don't have to speak Portuguese, the experience, the Spanish-speaking countries require conversational Spanish. Mexico, Ecuador, and Iquitos, Peru. And note that the experience in Iquitos, Peru is the other rotation besides Thailand that has the earlier dates in the first 3 weeks after Match Day. So Iquitos is in the northern state of Loreto, very close to the Colombian border, as you can see there. And Iquitos has been described as the densest city in the world with no road access. So the only way in is by boat or by plane. There are about 500,000 people that live on this island, and then there are another 500,000 that live in the rural community. And imagine, and the city is surrounded by the Amazon waters or its branches. And imagine branches and sub-branches and tributaries and little offshoots going to different villages. And some of the patients that we've seen there have traveled for 2 weeks by boat to get to medical attention. And this public hospital serves both the island community and the rural community in the state of Loreto. You can do peds or adult infectious diseases, and you'll also have an opportunity to work in a primary care clinic. Imagine a huge slum community, wooden shacks on stilts on the water, and the clinic is embedded within this community. You'll have an opportunity to do some home visits with the nurses by boat. There's a lot of malaria, dengue, lots of snake bites, and the elective experience is supervised by adult infectious diseases physicians and also by general pediatricians. So that's a quick rundown on the different options for you. A few other miscellaneous points for you. The experiences vary with the level of hands-on work, and some of them are more observational and experiential, and some of them are more hands-on. So China, Thailand, and India will be much more observational. The experience in Lebanon, you will probably be able to do some clinical work. All of the experiences in South Africa are very hands-on. So Cape Town and the two rural hospitals in KwaZulu-Natal. And in those rural hospitals, you can rotate in the emergency department, the men's wards, the women's wards. You can do OB. You can be first assisting in surgery. You can do peds. There's lots of hands-on on those experiences. Mozambique is more observational, and Mexico, Ecuador, and Peru are a bit more hands-on, and Brazil likely has some hands-on, a bit of hands-on. So the most hands-on are the experiences in South Africa, but also Mexico, Ecuador, and Peru. All right. There are some other resources that you may want to check out, particularly if you're interested in the opportunities in India and Peru. The Today Show, before the pandemic, traveled to Iquitos in the Amazon with some of our DGSOM students that were rotating there. And it's a 5-6 minute segment, and the link was sent out to you in the informational email message. And that's will give you a feel for the spirit of the setting. And another great video to give you a feel for the setting in the hospital, King Edward Memorial Hospital in Mumbai. There is a documentary on the teaching experience there that was made by an Indian documentarian. It's a little over an hour, but the first 10 minutes will give you a feel for the experience there. There are also a fair number of videos on the Global Health Program website with descriptions of the experiences from former students who have had the opportunity to have participate in these global health experiences. And of course, we're happy to help you if you have any questions. So we're optimistic that we're still going to be able to have this program at anticipated funding levels. There's obviously so much uncertainty, but we have gotten the green light and some reassurance from the dean's office that we can proceed as we're doing now. So it feels like it's pretty early to be going through the application process for electives that won't be until March or April. But some of our partner sites require processing of paperwork a fair number of months in advance. So we need to make these final placements by hopefully in October. Maybe early October, November, but we're going to aim for October. So it's fun to be able to share this with you. I will tell you personally that these experiences provide a priceless dose of perspective, and I come home from these experiences always with that renewed perspective. And there are so many things that we take for granted in our personal lives and in our medical lives. And I do think that we return from these with um, with a healthy dose of perspective and hopefully a greater commitment to working, addressing disparities here in our own backyards. So thanks for your interest and look forward to chatting more about specific experiences during the upcoming interview series at the end of the summer. All right. As soon as these MSPEs are done, we're going to start the interviews. All right. Take care now.